I'm Dr. Murali. I'm an orthopedic surgeon by profession, a joint replacement surgeon, and and founder of Hope Hospital. Uh, Yesterday, I spoke about a hospital management system which we developed. It's drmhope.com. Um, it has a feature. I would like to not touch upon what has already been spoken. I would like to talk about our journey, our quality journey. About 2-3 years back, we started on this journey, and like one of the speakers had mentioned, uh, you need to measure the various indicators. You need to improve on them. So how do you measure them? So um, we started with the most simplest application available, that is Google Apps. Uh, if I spoke to Padmanabhan yesterday, and he's a big fan of Google, and we thought that when you have this voluminous data, you have a quality manual that is running into thousands of pages. You have to have various forms to measure those indicators. You need to not only measure it, you need to convey it to the nurses, to the clinical staff, so that they improve on it. So now, how can that be done? You need to have a system wherein you're able to share all this data with your colleagues. Maybe certain documents they will be only allowed to view, certain other documents they'll be able to edit, and you give ownership of certain other documents. There are forms that you will allow certain of your managers to edit. Now, how is all that possible in a large organization? This is a big task in itself. That is when we thought of cloud computing, SaaS application, wherein all this data is able to, we are able to share these data with the colleagues. We are able to authorize a certain staff to view it, authorize a certain staff to edit it, and also even like simple thing like notify the staff if there is a change in the document, like by an SMS. If you have a quality manual and if you're making a change in one of those processes, there'll be a SMS that is triggered to the staff that need to be informed that such a change has been made in that document, or such a field has been added in the form. And all this has to be very user-friendly. You don't need to call the system IT guy to come down and then edit a form, add a field, or remove a field, or add a little pull-down menu. So these had to be done by the staff themselves. And all this was possible using this SaaS application that we had developed. We can discuss it after this session, or you can visit drmhope.com and have a look at it. So what does this application do? Is it captures all the data of the hospital to comply with all the objective elements, all the managerial indicators, all the performance indicators. You don't need to have various graphs on Excel sheets. The system generates those graphs, and those graphs are shared among the colleagues, among your staff members. There was a lot of discussion on how many people, how many hospitals have been accredited, how many are waiting. There are 479 hospitals waiting, but there are only 152 hospitals that have been accredited. So now, I find If there is a system to guide these hospitals, it is possible to achieve their goals faster and share these various documents, various processes, and achieve their goals faster. So, Mr. Anand Padman also talked about the McDonald concept. Now, that is, you standardize everything and then replicate. Now, this is something that our hospitals have already standardized. We are willing to share with you so that you don't have to do it all over again to replicate it. Here in this, we have put in a lot of importance for patient safety, HAI assessment forms, various ways to track it. We have a daily quality management system to identify, standardize, control, and manage the various quality processes. And not only that, we had a problem where the doctors would come up with their own smartphones, with their pads, and they would want to integrate with the system. And because the system runs with various devices, it can be run on various operating systems. We found that this is a great advantage to hospitals going for NABH. Thank you.